Hello, my name is Leah Carter, and I will be presenting my post-conference lesson plan on telemetry. Telemetry is an important topic as more than 610,000 people die of heart disease in the United States every year. Also, many patients, whether inpatient or outpatient, have comorbidities in which they need heart monitoring. Lastly, majority of newer nurses will be on a medical surgical floor in which they will encounter telemetry, hence the appropriateness of this content and having knowledge on this content to provide safe and quality care. I've been a nurse for 6 years on a medical surgical floor. To prepare for the nurse educator role, I did various clinical sites. My first site was at the VA hospital on a rehab floor with a clinical nurse specialist. In my second semester, I taught in an altered adult health course at Carthage College. Lastly, this spring semester, I did clinical practicum with Junior 1 level students on a medical surgical floor and ortho floor at Kenosha Hospital. I'm also a clinical instructor at an institution in which I started this position this past fall 2017, which led into spring 2018 as well. When I teach, I'm definitely focused on student engagement and overall student learning outcomes. I'm also dedicated to students gaining knowledge that would enhance their nursing practice. With telemetry, I'm highly knowledgeable about this topic from personal experience, and as mentioned before, being on a medical surgical floor for 6 years in which I encountered many telemetry patients. As with any topic and dealing with students and teaching new content and delivery of content, you have to have patience, which I have much of with students on learning a new topic. Telemetry is a procedure in which monitoring of the cardiac rhythm occurs. It can be a complex concept, therefore my expectations was not for students to be expert in this topic, but overall understand their role in advocating for the patient and providing appropriate cares. Therefore, I wanted them to be able to assess appropriately, collect data objectively and subjectively, explain basic processes of telemetry to patients, identify patient diagnosis or diagnoses related to telemetry, and overall create an effective plan of care in providing patient-centered care. These students were Junior 1 level nursing students at Carthage College. These students are involved in sports, sororities, fraternities, and taking a full load of credits. A lot of the students have family members who are in the healthcare profession, which drives their reasoning for nursing as well. These students often inquired about overall nursing practice and new content. Their average age was 20. There was 1 male and 7 females, and 1 out of the 8 students was African American. They often showed high anxiety, thinking they should know everything and feeling useless to the healthcare team. I often reminded them that knowledge grows and their skills are useful even when they think otherwise. The students were expected to come prepared with pre-lecture readings and assignments, understand the syllabus, and overall just take control of their learning to be successful in the course. These students, as I worked with them, I learned that their preferred learning style is to be very interactive to stay engaged. My clinical was at Kenosha Hospital, which is now called Frederick South. My first day of clinical was on a medical surgical unit, and my second day of clinical in the week was on an ortho unit due to schedules of clinical groups. The units were all created the same with 11 patient rooms in a circle and a nursing station in the middle. Post-conference was not on the unit. Post-conference was held off unit in a conference room. The post-conference room had 18 chairs outlining the room with rectangular tables. There were 2 computers that students had access to, which they could pull on the unit when providing patient care. There were Christmas decorations on the floor, which made me think that sometimes this conference room is used as a storage room as well. And there was also a massive supportive beam, which you'll see on the next slide, that prevented you from seeing all students and making eye contact when teaching. There were 3 objectives to my lesson plan. The first objective focused on the students being able to discuss with identified patients needing heart monitoring the need and basic steps to telemetry monitoring. This was Bloom's effective response to phenomena and Fink foundational knowledge. The assessment of learning was the instructor, myself, doing an observation and performing the skills checklist assessment with expectations that were shared with the student. Learning Objective 2 would help the students explain the importance of prioritization with telemetry patients. This was Bloom's understanding and Fink foundational knowledge and application. The assessment of learning was the post-conference case study discussion and reflection. In Learning Objective 3, students would relate the patient diagnosis or diagnoses, the history, plan of care, medications, consults, anything related to the patient to telemetry. This was Bloom's Cognitive Apply and Fink Foundational Knowledge and Integration. The assessment of learning was to create a concept map relating the patient diagnosis and overall patient care to telemetry monitoring. This is a map of my active teaching strategies. In the first column, you will again see the learning objectives 1 through 3. In the second column, the information gathering, you will see how students were to gather their information using the institution intranet for policies and procedures on telemetry and reviewing their Jarvis book on health assessment, cardiac topics, and completing a health assessment. They could also review their pathophysiology textbook on cardiac functioning as well. In the experience component, students will provide direct primary cares to a telemetry patient, which will be assigned by me. I would then observe them doing a skill assessment with the skills checklist. The students would also experience by doing a concept map on telemetry as well. In the reflection component, post-encounter with their assigned telemetry patient, I would pull the student aside and sit down one-on-one and see the value from their encounter with their telemetry patient, what they learned, how they felt, how they think they did on overall patient care with their telemetry patient. They could also take our discussion and share with their peers in post-conference. With that, we would also do a post-conference case study with discussion and questions, which could also promote further reflection. With this post-conference, I assessed student learning in various ways. In the forward-looking assessment, I did a post-conference case study discussion and reflection. For self-assessment, the students would do a concept map. Other assessments involve the skill assessment with the skills checklist and reflection that would occur with myself and the student one-on-one, which could also carry over to discussion and post-conference with their peers. After much work put in, unfortunately, I was not able to do this lesson plan due to time constraints in clinical. Therefore, student benchmarks are unknown. I would have loved to do this lesson plan and see the student learning outcomes. Although I'm not able to give the exact outcome of this lesson plan, I do believe that this lesson plan would have went well due to the student engagement activities and learning a new concept. I wish I could have done the lesson plan to not only assess student learning, but my overall development and lesson plans for teaching content. Here are my references. Thanks for watching and happy graduation!